Okay.
Good morning. How many of you know someone that has a chronic illness, example, cancer or diabetes, that their health insurance is not paying medical expenses or doesn't cover it? Right now, there are plenty of Americans that are facing this problem. Over 20 million Americans do not have health care insurance. Medicaid and Medicare are the two government-run programs that offer reimbursements to hospitals, healthcare providers for citizens that cannot finance their own medical expenses. Medicaid serves all ages, while Medicare cater for the seniors who are 65 years and up, and some who are under, some special ones who are under age 65. They are treated by Medicare. The coverage and expenditure for Medicare and Medicaid expenses have been increasing steadily over the years. If you ask me, it will be you and I who will be paying for these expenses. These estimates are projected to increase in a few years, which is not far from now. And you may not be affected right now, but you will be in the long run. Maybe your aunt, your mom, your uncle, or someone is facing this expenditure or paying some part of it. And once you work paying taxes, you are basically paying for it as well. Our Congressional Budget Office and Center of Medicaid and Medicare Services has estimated an increase in Medicare expenditure from $720 billion in 2009 to approximately $1.4 trillion. And think about it, that's a lot of money. Where is it going to come from? What do you think? Between me and you. And also, by 2019, which is 10 years from now, this is where this estimate is expected to take place. We cannot afford for this to happen. What is going to happen to our Social Security? For those of who work for the states, what's going to happen to your retirement fund? We cannot afford not to do anything, so let's take action. One solution is the government is trying to present to us a new healthcare plan. And to me, we need to do something as I said. So this new healthcare plan guarantees 96% coverage for Americans, which is a very good figure. Our population is over 300 million. Therefore, 96% is a very good figure, if you ask me. Also, the new package or the new plan will restrict insurance companies from denying citizens coverage who has pre-medical medical condition. And that is not fair in my opinion. If I am sick and I come to you for coverage, you should be able to provide coverage for me, and the government is seeking to eliminate this behavior by the insurance companies. Also, it offers a public option. A public option means you will be able to not stick with the government plan. You will have some form of competition with insurance companies out there that are presently existing. And also, this public option will offer competition to the existing insurance companies, and also may force them in the long run to reduce their premiums and make it affordable for our low-income families, or I want to say the middle class or lower class. Also, their requirements for health insurance coverage may also change. This new plan will also force them to change their strategies by lowering premiums, not denying coverage because of your pre-existing medical condition. And to me, that is very fair, and it's a good step towards making a change. We need to have insurance companies that really care about our health and wealth rather than care about making money or just making a profit. Therefore, let's support the new healthcare plan. From my survey, most of you do agree or support President Obama's new healthcare plan. And for those of you, the few, which is about 19%, I hope by the end of my speech you will agree with me and try to do something about it in order to make change. 10% of our population is unemployed. Think about it. Who is going to pay, or who is paying already? Let us not forget, unemployment of 10% is the highest it has ever been. And again, our population is over 300 million, so we're talking about millions of Americans who are not working. Therefore, they cannot afford health care or health insurance. And the government has to pay that through Medicaid and Medicare. And somebody has to pay for it, which is you and I, as well as the government. Also, another factor that is affecting our healthcare industry and its expenses, or increase in expenses, is the excessive regulations, meetings, debates. All these things that are excessive are causing increase in our budget. In an article, it estimates that $339 billion has estimated to increase $339 billion in excessive regulation will be costing our government. Also, this is netting $169 billion increase over consumer spending. Therefore, it is an increase of $169 billion of what consumer spends on gas and oil per year. And to me, that's outrageous. We cannot afford this waste any longer. We need to take action. There are other sectors in our economy that really needs this money and could use this money that is going to waste in just regulation, all right, instead of treatment. Let us stop and take a look. Look at what's happening in our society today. Let us take a moment, think about the people that are unemployed. Families that have no health insurance and insurance companies that refuses Medicaid patients. Would you like this to happen to you, your family members, your children? I wouldn't like that to happen to me or anyone for that matter. That's why I'm encouraging you guys to support the new healthcare plan. Take a closer look at what's happening in our society, health insurance industry. The companies are taking advantage of our society by overpricing their healthcare services that they offer to patients. One reason because there is no transparency in the transaction with the patients, the physician, and the insurance company. Do you think this would happen if we have an auditing team that audits all three parties that are involved, the patients, the physician, and the health insurance company? Do you think all these expenses will occur? I don't think so. Medicaid officials that pay these claims are also contributing to the increases of Medicare and Medicare expenditures. President Obama's new healthcare plan will eliminate these behaviors. And also remember, it guarantees 96% coverage for all Americans. And also it restricts insurance companies from denying coverage because you have pre-existing conditions. Let's take a look around. Take a look at Amanda. The public option plan will bring some competition. It will bring some competition to the existing insurance companies and possibly reduce the premiums. Take a look at Amanda. Look at her. She's young, hardworking, ambitious, and she has been denied by several insurance companies. For what reason? Because she has a pre-existing medical condition. The new healthcare plan will eliminate this. All right, so therefore we need to support it. We need to fix our healthcare system by supporting the new healthcare plan, and the president is trying. The House of Representatives has passed the bill to help, so therefore help is on the way. It is time for a change. Healthcare should not be a stress or depressing. This is America. We need to support the government and support one another by supporting the new healthcare plan and re-establish the American dream. Thank you.